Now, atypical cervical vertebrae. It is first cervical vertebrae called atlas. It is 7 cervical vertebrae called axis. The first cervical vertebrae, atlas. The first cervical vertebrae is called axis. It is ring shaped. It has no body and no spine. The lateral processes has foramen transversarium in both the cervical vertebrae. Atypical. The anterior arch is short, posterior arch is long. Long posterior arch, right and left lateral mass, transverse processes laterally. First, the anterior arch is marked by a median anterior tubercle on its anterior aspect, and its posterior surface bears an articular facet for the dens or the odontide process of second cervical vertebra, and it fits into in this way. Now, posterior arch. The posterior arch is longer than the anterior arch. The posterior arch forms about 2/5 of the ring and is much longer than the anterior arch. The posterior arch, this is upper surface, this is lower surface. Its posterior surface is marked by a median posterior tubercle. It is median posterior tubercle. The upper surface of the arch is marked behind the lateral masses by a groove. This is the groove. This is the groove. Now the lateral masses. The lateral masses show elevation. The upper surface bears a superior articular facet. The superior articular facet is elongated forward medially and is concave and is directed upward and medially. It articulates with the corresponding condyle to form an atlanto-occipital joint. With the occipital condyle of skull to form an atlanto-occipital joint. Now we see the lower surface. It is lower surface of the atlas. The lower surface is marked by an inferior articular facet. It is circular, more or less flat. This facet is directed downward, medially and backward. It articulates with the corresponding facet on the axis. This is the corresponding articular facet to form an atlanto-axial joint. This is atlanto-axial joint. This is the atlanto-axial joint. Now the medial surface. The medial surface of the lateral mass is marked by a roughened tubercle. It is more visible on the superior when we see on the superior aspect. The transverse process projects laterally. The transverse process which projects laterally. It is unusually long and can be felt on the surface of the neck between the angle of the mandible and the mastoid process. Its long length allows it to act as effective lever for rotatory movement of the head. The transverse process is pierced by the foramen transversarium. This is the foramen transversarium, and also the second cervical vertebra has foramen transversarium, and the vertebral artery passes through these foramen. This is the foramen transversarium and this is the foramen transversarium. These were the cervical vertebrae.